If you are over 60 and you take Amlodipine, Losartan, or Lisinopril for blood pressure, there is one question you need to ask yourself today. Not whether you take it on time, not whether your last reading looked pretty good, not whether your doctor once said everything was under control. The real question is this: do you actually know what that pill may be doing inside your body now? After months or even years of taking it? Because that is where many people make a very quiet mistake. They think taking the medication is the whole job. It is not. Taking it is only part of the job. Understanding what to watch for, that is the other part. And after 60, that part matters more than most people realize. Because blood pressure medicine does not just lower a number on a screen. It affects circulation, fluid balance, kidney stress, the way your body responds to dehydration, the way you react when you stand up too fast, the way other everyday products, even things from a grocery store or pharmacy shelf, can suddenly become more important than they seem. And here is what worries me. So many older adults are doing their best. They are not careless, they are not reckless, they are not skipping pills for fun or ignoring their health. Most of them are responsible, they are disciplined, they follow routines, they keep appointments, they try to eat better, they try to do everything right. And still, many of them are taking these medications with only a partial understanding of what their body may be trying to tell them. That is what makes this so important. Because when you do not recognize the pattern, you can miss the message. You can explain away symptoms that deserve attention. You can panic over symptoms that are common but manageable. Or worse, you can suffer quietly for months because nobody explained what was normal, what was not, and what should never be ignored. So today, I want to change that. My name is Dr. Clara Hoffman, and on this channel, my goal is simple: to give you clear, practical health information in plain language so you can protect yourself, ask better questions, and feel more confident about the medications you take. By the end of this video, you will understand Amlodipine, Losartan, and Lisinopril in a much more useful way. Not just what they are called, but how they differ, what they commonly trigger, what many seniors still do not know, and which warning signs deserve real attention. Let me start with 3 situations, because this is where the misunderstanding usually begins. Imagine a 72-year-old woman taking Amlodipine exactly as prescribed. She is careful, she is organized, she misses almost nothing. Then gradually, her sandals feel tighter by the evening, her socks leave marks, her ankles look puffy, her legs feel heavy at the end of the day. She starts wondering if her heart is getting weaker, if her kidneys are failing, if something serious is happening. Now imagine a 68-year-old man on Lisinopril. At first, everything seems fine. Then one day he notices a dry, irritating cough. No mucus, no fever, no obvious cold, just a stubborn throat tickle that keeps showing up, especially at night. He blames dust, then weather, then allergies, then acid reflux. Weeks pass, then months. Still coughing, still not connecting it to the medication. Now imagine a third person, age 76, taking Losartan. He decides to make a healthy change. He cuts down on salt and starts using a salt substitute because it sounds more heart-friendly. It seems smart, responsible. Exactly the kind of change people are told to make. But without realizing it, he may be adding extra potassium on top of a medication that can already affect potassium balance. And that can matter more than he thinks. 3 people, 3 different symptoms, 3 different medications, but one shared mistake. They all assumed blood pressure medicine is just blood pressure medicine. One pill, same idea, same concerns, same rules. It is not. That assumption is where many seniors get caught off guard. Amlodipine, Losartan, and Lisinopril may all lower blood pressure, but they do not behave the same way. They do not create the same patterns, and they do not send the same warning signals. Amlodipine works by relaxing blood vessels in a way that helps blood flow more easily. Lisinopril works through a hormone pathway that affects how tightly blood vessels constrict. Losartan works on that same general pressure regulating system too, but at a different step. That means different mechanisms, different side effects, different misunderstandings, and different clues your body may give you. Once you understand that, The medication stops being just a tablet. It becomes a pattern. And patterns are what keep people safe. Let us start with amlodipine, because one of the most common things it can do is also one of the most misunderstood: swelling in the ankles, feet, or lower legs. This is where people often get scared. They see swelling and assume the worst. Maybe my heart is failing, maybe my circulation is collapsing, maybe my kidneys are shutting down. And yes, swelling should always be taken seriously enough to mention. But with amlodipine, the explanation is not always what people think. Sometimes the medicine relaxes the arteries so well that fluid pressure shifts in a way that makes swelling show up in the lower legs and ankles. That is why many people notice it later in the day. Shoes feel tighter, socks leave grooves, the legs feel fuller, heavier, more uncomfortable by evening. Then it improves overnight, only to return the next day. Now here is the real danger. Not always the swelling itself, but how people respond to it. Some stop the medication on their own. Some start drinking less water because they think they are holding too much fluid. Some say nothing for months and simply start walking less because it feels uncomfortable. That matters, because when older adults walk less, they often lose strength, confidence, and balance faster than they expect. So if you take amlodipine, remember this: swelling is information, not a reason to panic, not something to hide, but absolutely not something to silently normalize if it is persistent or getting worse. Now let us talk about lisinopril, because this one causes a problem that many people miss precisely because it seems unrelated. The dry cough. Not a chesty cough, not a wet cough, not something dramatic. Usually just a dry, annoying, nagging cough that hangs around and makes no sense. And what makes it tricky is timing. Some people assume that if a medicine causes a symptom, it should happen right away. But that is not always how this works. A cough can show up later, after the medication already feels familiar, after the person has stopped thinking of it as new. That is why many older adults spend weeks chasing the wrong explanation. Allergies, dust, a cold that never fully left, something in the bedroom, something in the weather. Meanwhile, the real cause may be sitting in the medicine box the whole time. And the longer that connection is missed, the longer the person suffers needlessly. But with lisinopril, there is something even more important than the cough. And I need to make this distinction very clear. A dry cough may be irritating. Swelling of the lips, tongue, face, or throat is different. That is not a watch and wait symptom. That is urgent. Because if swelling starts to affect the mouth, tongue, swallowing, or breathing, that can become dangerous very quickly. So if you remember only one thing about lisinopril, remember this: a cough is something to report. Swelling around the face, lips, tongue, or throat is something to act on immediately. Now let us move to Losartan, and also to something that matters for both Losartan and lisinopril more than most seniors realize: potassium. This is one of those issues that often stays invisible until a blood test shows a problem. And by then, many people are shocked because they thought they were making healthy choices. Here is what happens. A person is told to reduce sodium, so they buy a salt substitute. They see words like heart smart, better choice, healthier option. What they do not always realize is that many of those products replace sodium with potassium. So now they are using extra potassium every day while taking a medication that can already shift potassium balance. That combination can become risky. And what makes potassium problems difficult is that they do not always announce themselves clearly. Sometimes the signs are vague: weakness, fatigue, cramping, strange tingling, a racing, pounding, fluttering, or irregular heartbeat. Sometimes the symptoms are subtle. Sometimes there are very few warning signs at all until the number becomes more serious. This is why I want you to think beyond food myths and beyond simple advice like watch bananas. Potassium may be hiding in salt substitutes, powders, electrolyte products, supplements, and other things people do not think to mention. If you take Losartan or Lisinopril, that information matters, not because the medications are bad and not because healthy eating is wrong, but because the chemistry inside the body does not care about good intentions. And that brings us to one of the most overlooked parts of blood pressure treatment after 60. What happens when you get sick? Not a major emergency, just ordinary real life. A stomach bug, vomiting, diarrhea, a few days of poor appetite, hot weather, not drinking enough, sweating more than usual. After 60, dehydration can change the whole picture faster than many people expect. The same blood pressure medication that feels perfectly fine when you are well hydrated may suddenly feel much stronger when your body is depleted. That means dizziness can show up more easily. Weakness can hit harder. Blood pressure can fall lower than expected. Kidneys can become more vulnerable. And this matters especially with Losartan and Lisinopril. The pill did not suddenly become dangerous overnight. The environment inside the body changed. That is the part many seniors still do not know. Illness changes the rules. And if nobody has ever talked to you about what to do with your medication when you are vomiting, barely eating, having diarrhea, or struggling to keep fluids down, then there is a gap in your safety plan. That does not mean you should make medication decisions by yourself. It means you should know ahead of time what your own clinician wants you to do if you become dehydrated or acutely ill. That kind of plan is not optional information. For many older adults, it is essential. Now let us talk about another quiet trap: pain, back pain, arthritis pain, knee pain, shoulder pain, the kind of thing that sends people to a drugstore shelf without much thought. Ibuprofen, naproxen, a common anti-inflammatory, something familiar, something ordinary. And that is exactly why people underestimate it. But when medicines like Losartan or Lisinopril are mixed with anti-inflammatory pain relievers, especially in older adults, and especially when dehydration is also part of the picture, kidney stress can become much more likely. This is where people get fooled by the fact that the product was sold over the counter. They think, if I can buy it easily, it must be harmless. But your kidneys do not care whether the medicine came from a prescription bottle or a store shelf. They react to the effect. So if you take Losartan or Lisinopril and you also use anti-inflammatory pain relievers regularly, that deserves a real conversation with your doctor or pharmacist. Not because every dose is automatically disastrous, but because casual, repeated use without understanding the interaction is where trouble can grow quietly. Now, I want to talk about something many seniors dismiss because it seems too small to matter: that brief dizziness when standing up, that little wave of lightheadedness when you rise from bed, that split second when you reach for a chair, a wall, or a counter until the feeling passes. People excuse this all the time. I got up too fast. I am just tired. It only lasts a second. But after 60, a second is enough. A second can lead to a stumble. A stumble can lead to a fall can lead to a fracture, and a fracture can change the course of a person's independence in ways that are hard to undo. That is why blood pressure treatment is never just about getting the number down. It is also about how safely you move through your day. If your medication, your hydration, or the combination of several factors is making standing up feel unstable on a regular basis, that deserves attention. Sometimes the fix is simple. Rise more slowly. Pause at the edge of the bed. Stand first. Walk second. Hold on to something stable. But if the dizziness is frequent, getting worse, or coming with near fainting, that is not something to quietly accept as just part of aging. Now let us clear up another problem that creates unnecessary fear in so many homes. One blood pressure reading is not the whole story. Blood pressure moves. It changes with pain, poor sleep, stress, caffeine, anxiety, rushing, talking, worrying. Even thinking about the number while the cuff is inflating can affect the result. So when someone sees one high reading and panics, or one low reading and assumes the medication suddenly became too strong, they often make bad decisions from a single moment that had no context. They skip pills. They double pills. They frighten themselves with a number that did not represent a true pattern. What matters more is consistency. Same arm, Similar time of day. Sitting quietly first. Repeated over time. Patterns help doctors make decisions. Panic does not. If you monitor at home, bring the pattern, not just the most alarming number. That gives your doctor something useful. Now, there is another mistake that causes trouble quietly: inconsistent use. These medications work best when they create steady control, not chaos, not guesswork, not a pattern of missed doses, doubled doses, and last-minute corrections. Some people forget a pill and take two later because they get nervous. Some stop for a few days because they feel fine. Some take extra because one reading was high. But these are not rescue pills. They are stability pills. And when stability turns into improvisation, the body feels it. Pressure can swing, symptoms can become more confusing, and people often blame the medication when the real problem is the inconsistency. So if you have ever been unsure what to do after a missed dose, do not wait until the next mistake to figure it out. Ask your prescribing clinician in advance and keep those instructions somewhere easy to find. That small step can prevent very big confusion later. Now, I want to come to what may be the most important point in this whole video. The best blood pressure medication is not just the one that lowers a number. It is the one that lowers blood pressure safely, predictably, and in a way that still allows you to live your life well. If a medicine lowers the reading but leaves your ankles so swollen that you stop walking, that matters. If it controls the pressure but gives you a cough that ruins your sleep, that matters. If it leaves you dizzy enough that standing up feels unsafe, that matters. If it interacts with dehydration, pain relievers, or hidden potassium in ways nobody explained to you, that matters. Symptoms are not a sign of weakness. They are not you being difficult. They are not proof that you are failing. They are information. They are your body reporting back on the treatment plan. And one of the biggest mistakes older adults make is assuming they are supposed to suffer silently because the medication is important. Important does not mean untouchable. Sometimes the dose needs review, sometimes the timing needs adjusting, sometimes the side effect needs to be recognized, sometimes a different medication may fit the body better. But those options only become visible when you speak up. So let me leave you with a simple framework. If you take amlodipine, pay attention to swelling in the ankles, feet, or lower legs, especially if it builds later in the day. If you take lisinopril, do not ignore a persistent dry cough and treat swelling of the lips, tongue, face, or throat as urgent. If you take Losartan, be careful with hidden potassium sources like salt substitutes, and do not brush aside weakness, unusual fatigue, or a strange heartbeat. With all three, stand up slowly. Pay attention to dizziness. Be cautious with anti-inflammatory pain relievers unless your doctor says they are appropriate for you. Do not react to one isolated blood pressure number like it tells the whole story. And make sure you know what your clinician wants you to do if vomiting, diarrhea, illness, poor fluid intake, or heat suddenly changes the situation. And above all, do not stop or change a prescribed blood pressure medication on your own without speaking to your prescribing clinician. You watch this because you care about your health. That matters. It means you are not on autopilot. And after 60, that alone can make a real difference. My goal is not to leave you afraid. My goal is to leave you clearer, because clarity changes the way people take medicine. It changes the questions they ask. It changes the symptoms they notice. And sometimes it changes what gets caught early enough to prevent a much bigger problem. If this helped you, share it with someone over 60 who takes blood pressure medication. A spouse, a parent, a sibling, a friend. Because many people do not learn this information until after something starts going wrong. And if you want more practical health guidance explained in plain language, stay with me. I'm Dr. Clara Hoffman, and I'll see you in the next one.